Hi, my name is Samantha. I am 25 years old and I have cystic fibrosis. Along with that, I have cirrhosis of the liver, I have a Crohn's disease, I have esophageal varices, I have chronic lung infections as well as chronic sinus infections. I have asthma. I have osteopenia, and as of right now, and I have diabetes, cystic fibrosis related diabetes. So, that's just a little bit about me. This is my back brace. I did a video about it because it's a new thing for me. So I'm just wearing it, not for any, not to make my boobs look bigger or anything like that. So, because I did notice that it kind of did have that effect. I've been making posts at least the last week about my CF and my CF routine, or my CF and the devices I have and I get to use because of the CF. And first off, I would like to mention that I am not a very shy person. I try to be a very blunt, honest, real, in-your-face kind of, well, not in-your-face kind of person, but I try to be as honest as I can. I do not like to pry on my CF and make it like my main focus of life, or have me be the main focus of other people's lives because they're worrying about me, because people care. I'm not trying to do any of that. So with that being said, I do try my best to just kind of keep the CF and the not feeling too good and stuff like that to myself. Don't get me wrong, I will mention that I don't feel good. I will mention that my body is achy and stuff like that every once in a while. I do really, really try my hardest not to be nagging about it, not to bring it up all the time, etc. If somebody asks me a question and I know the answer, yes, I will answer it. If you ask me a question, by chance I don't know the answer, because you know what? I don't know everything, even about CF. I might have CF, but I don't know everything about it. So if you ask me a question that I do not know the answer to, I will tell you I don't know the answer to it. If the question interests me, and then I might want to find out the answer for myself. I'll also let you know what I find. But if it interests me, I'm going to find out the answer anyways and let you know. If I'm not interested in the question you asked, I'll probably just tell you to go and look it up yourself. I try not to pry on life expectancies of CF patients, mainly because I've beat every single one they've given me so far. So after you hear you're going to be dying at a certain age 10 times, I'm sure that's exaggerating, but after a number of times, you just kind of don't believe that anymore. Well, at least that's how I feel. They can tell me I'm going to die in 2 months, and I'll look at them and be like, okay, I'll see you in 3. Although I'm sure if it's that close, I'm sure they have a better chance of being kind of right on when I'm going to die. But that's beside the point. I I've been asked if I'm afraid of death. No, I'm not afraid, actually. Unfortunately, when I say unfortunately with a very heavy heart, I have lost people to CF. Other than the fact that I have it, because you can never get rid of it. So, other than the fact that I have CF, a really good friend of mine, Angela, had CF. We met at a CF conference because back in the 90s they did CF conferences, at least in Florida, where vendors and different companies came out, showed their product to the doctors and to the parents, while the children went off and learned about other stuff. We would learn about germs, we would learn about nutrition, exercising, stuff like that. We would do arts and crafts. They did break it up in groups of age. I was able to bring my best friend Bobby Jo, who knows she does not have CF, but she has been a very big support to me. So I was able to bring her to one of those. Shortly after, though, they stopped doing the conferences. I think just in general, although I did hear at least a year or so ago that the conferences still do happen, they still do go on. They just urge and do not require and strongly suggest CF patients do not attend the conference because it is a big risk to them and then to every other person in that, well, mainly just the CF person, or people. But it could also be a risk for somebody else because you don't know what's all going on. I'm sorry, guys. But I just wanted to make this because I have noticed I have talked a lot more about my CF the last few days because of the devices I have or the things I want to show you or things that I think are cool or I get excited about. I want to show you. I want people to see and know. And I just feel like this is the most I've talked about CF in at least 10 years probably. Probably my entire life, to be completely honest. Again, I don't try to pry on my CF and make it, it's not an excuse for me to not do anything. I wake up in the morning, I cook, I clean, I do all the housewife things, I help other people, I babysit, I do it all. Like, there's really not anything that I can't do. I'm sure there's things I shouldn't do, but I will do whatever I want. I will do my best to be there for my friends and my family. I try my best to just be there, and as much as they help and they support me, I want to be able to help and support them. Maybe not financially, because we're not financially completely stable right now. Yes, I am. But they've been supportive in other ways, and I would love to be able to pay back that support. As far as living with CF, I've done it my whole life, so I don't know any other way to live. As a teenager, I went through my little spouts where I decided that I was all better and I didn't need to take any of my medicines. I didn't have to take any of my medicines. I didn't have to do any of my treatments. I didn't have to do anything. I was just a normal girl. And then maybe 2-3 weeks later, I was in the hospital. So, as much as I wanted nothing more than to be like every other kid in my neighborhood, I wasn't. Unfortunately, it has taken me this long in my life to be happy with the fact that I'm not like everybody else. Do I wish I had CF? No, of course not. The thinking about it completely honestly right now, I wouldn't change it. Because if I didn't have CF, I would not be half the person I am today. I would probably be a drug addict. Not even... Sorry. Not even on a joking level. I'd probably be an alcoholic or a drug addict or both. And with like 6 kids by 6 different dads probably. I don't know that future because I don't have to live that future. I think me having CF and having to deal with such a big thing at such a young age has definitely helped me be a stronger person. And I'm not saying strong as in I never cry, because that's not true. I do. Actually, ever since I had gotten pregnant the one time, I cried for absolutely no reason. And that's a different story. And it also had to do with my CF and why you do not see or hear a screaming baby around. Actually, I'm just going to dig right into that one because I watched something earlier, and this girl, her name is, I think, Faith Ann. I don't know what the last part is. So it's Faith Ann, and she had a video up this morning about being pro-choice or being pro-alive. And it does depend on who you ask, and this subject is so different for so many different people. I can tell you right here, right now, I do not like abortion. I think abortion sucks. 1. 2, on the other hand, I've had an abortion. Now, go ahead and call me a hypocrite all you fucking want. The last thing I would have ever wanted to do, and still to this day, because it still fucking haunts me, to this goddamn day, would be getting an abortion. When you have 5 different doctors, one being a high-risk OBGYN, telling you that if you go through with this, you're going to die and so is your child. Or, let's just, off chance, it comes down to you or your child. Well, for one, I would tell people to choose my child in a heartbeat. No, I don't care. My kid deserves to live. But that wouldn't be fair to everybody else. Me leaving a kid behind for other people to take care of. And me being the person I am, I don't really trust a lot of people to take care of a child like I would. There's a few people that I'd be like, yeah, them I trust with my kid. And there's so many more people that I don't. So, with that being said, in 2013, November 2nd, 2013, I believe, I go to the emergency room thinking I have a stomach flu. Because I'm just nauseous all the time and super tired. Definitely just thinking it's the stomach flu. And a doctor comes in and, is like, congratulations, you're pregnant, and all this other stuff. And for one, I was in shock. Now, the next thing I said was, are you sure? Because I've actually had people come in with the wrong chart and tell me I've been pregnant before. And I'm like, are you sure? Like, I don't think so. And then they're like, oh, well, what's your name? I'd be like, Samantha. At the time, it was Samantha Bennett. And they're like, oh, this is the wrong person. I was like, I figured. And at the time, it was Samantha Bennett still. I was like, are you sure? Sometimes they grab other folders. It's happened to me before. He said, is your name Samantha Bennett? I was like, yes. He's like, is your birthday the 21st of November? I was like, yes. He's like, no, then this is you. Congratulations, or whatever, but you need to get in to see a high-risk OBGYN. plain point to the plain, simple, and to the point, exactly what he told me. I needed to go see a high-risk doctor to help me make my decisions and help me go through everything. I go see this doctor. She, from the fetus's standpoint, everything was fine. And even with my health at the time, everything was fine. I also found out in like 2 months instead of it being longer or whatever. But with my lungs, fine. Fetus, it's perfect. And then a GI doctor, which is a gastroenterologist who his specialty is your stomach and your abdomen and your intestines and all that crap. Literally, actually. So all of a sudden my GI doctor comes in, explains to me that there would be no room for the baby and it would die. Or it could cause me to die because there would be no room for the baby. Other organs could shut down. Now, knowing that, feeling as crappy as I did, and I didn't make that decision that day. I think that was maybe the 12th of November when I got to see her. That's just the OBGYN. Now, the pulmonologist I saw on my birthday that year of 2013, and we were all discussing it. And then my GI doctor comes in. First, my pulmonologists are like, your numbers are great right now, but with you being pregnant, they will decrease. We're like, it's not. He did tell me it's not like 100% guaranteed they're gonna like drastically decrease, but they will decrease, and it could be very bad or it could not be that bad. It just depends on the person, and that is what it is. Then I had a GI doctor come in and my endocrinologist, which if you don't know what that is, it's a diabetes doctor. I had both of these doctors because they all worked on the same freaking floor. So I had all 3 doctors sitting with me in a room on my birthday, 2013, and they are telling me that having the baby would put me at risk and would put the baby at risk. As in, the baby could die. Like, I could have a miscarriage. I could possibly die. We could both die during labor. While the baby is growing inside me, my body can start to reject it and then have a miscarriage. Or my body will start shutting down other organs to make room for the baby. That's obviously not good. So, CF sucks. And that's my story. That's why I agree abortion. I don't like abortion. I do, however, agree that women should have their own choice. Abortion should not be used as birth control. I don't believe in that. And I believe that you really need to be tested and see a psychiatrist before, or a psychologist, or at least a number of doctors before going through with an abortion. Only because I've known a lot of people who's regret it. I regret it. I did it for what was best for me and my child, but I still regret it. I wanted nothing more than to be a mom, and I passed that up because I was scared for my life and for my kid's life. So I didn't do it. I didn't go through with it. And it does still get to me to this day. I know what I did. I think what I did was illogical and made logical sense, and it was realistic, but that doesn't take away the pain and the hurt that it has already caused. So, you know, having CF, there's so many other things that are involved with it that it's not just a buildup of sticky mucus in your lungs, which is what CF is. That is, CF makes all the mucus in your body way thicker, making it harder to get out, which is why we need to do the albuterol nebulizers. That's why we had to do the vest, or we had to do hand respiratory therapy, any kind of respiratory therapy. And that's, you know, that's what it is. So CF's not something you should take lightly. Again, there's so many other things wrong with this world that I personally feel like nobody should be focusing 100% on just themselves. Yes, work to make yourself a better person, but don't be a conceited cunt. Just don't. Sorry. So, for those of you who now know I have CF, and for those who didn't know I had CF to begin with, now you know more of a backstory than anything. Pretty sure I got off a topic a lot in this video, and I'm sorry if I did. I tried to always bring it back to the topic, but at this point I didn't remember what the topic is. So, I'm just going to let it simmer with you guys, I guess. If there's any questions or statements, comments, whatever, I'm not going to tell you not to write me or whatever. You can write whatever comment you want to write. You can ask whatever question you want to ask, and that is it for now. So, with all that being done and said, I would like to wish you all a very nice evening, and I hope everybody sleeps well, and I hope everybody is staying safe and just enjoying life. Because sadly, you don't know when it's ever going to end. So live your life. I'm not saying go out and do a bunch of heroin, because that's not really living your life. That's being a drug addict. Live life. Do things that excite you. Do things you're passionate about. And be with people. Surround yourself with people who love you and care about you, want to see you do good, and want to help you be a better person. Don't consume yourself with people with negative thoughts and people who are always just stuck in whatever situation they have been in and for years and years and years, and there's no getting them out of it. You've tried, because I've tried with multiple people to help them. It doesn't always work, and sometimes you just need to cut bait. So, again, for you, for your health, your mental health, your physical health, your emotional health, do what makes you happy. Be who you want to be. Love who you want to love. And just take care of yourself. Stay healthy. Stay happy. Stay safe. And above all else, enjoy the life you are living to the best of your abilities. Thank you for watching. Again, any questions, comments, They're all welcomed. This is what CF is to me. It's not my day-to-day topic. It's not who I am. It's what I have, not who I am. So I think a lot more people should learn that things going on with them is it's what's going on with them. It's not it doesn't make them the person who they are. It helps, but it doesn't completely. So again, I keep saying bye and I never hang up, so or turn off the camera. So bye for real this time, and again, stay safe.